Well, thank you for the introduction. So we consider ourselves as a 24-hour on-demand healthcare provider. So basically, when you look back a few years, people, or even still now, people go either to Google, right, and try to figure out their medical stuff on their own, or they they need to go to the hospital and then wait for a few hours there, right? We decided that we go into the middle of those two extremes and basically combine the quickness, the fast access of digital with the quality of doctors. And I mean, probably everybody knows, but healthcare is a huge market, right? It's not really about market size, it's always about market penetration. Healthcare is a very new topic, or digital health is a very new topic, and in Europe it's basically a pioneer market. These are the German numbers, because Germany is a very nice market in regards to healthcare, because people go crazy often to the doctor. Germany has as much healthcare or as much doctor appointments as the US. But Germany only has, almost a fourth of the population. Germans like their healthcare. And a Deloitte study says that around 50% of all these appointments could fundamentally be done online. Because it's not about any type of blood work or anything like that. It's about what the patient answers to the doctor's questions. And this is actually what we do. We provide healthcare either on site, so we send our doctors to the patient's home. The app basically in that regard is like Uber. You pick your location, you click I want a doctor, and then within 1 hour on average we send one of our doctors to the patient's home. The patient is being treated, advised, and diagnosed at home, and then for any type of follow-ups, so any type of follow-up questions, any type of refill prescriptions, whatever is needed, after the consultation we connect the patient to our digital consultation system. In that regard, any type of what is being needed after a visit can be done digitally. And also digitally, we advise patients as a first contact. So there is a lot of stuff which is currently being solved with Google, like these simple questions, like, am I allowed to give medication X to my child? Am I allowed to fly to the US if I'm pregnant, right? These simple stuff where not necessarily a doctor visit is necessary, but where still some kind of fear might exist or where you need medical advice from a professional. And these we do digitally together with our insurance partners in Germany and soon most likely also in Switzerland. Just to give you a bit of idea, we have a few hundred doctors for house calls and for digital advice. We have a lot of patient data, and just as we heard, machine learning is a very interesting thing also in healthcare. To support our doctors, we employ a machine learning system which basically picks follow-up questions which we can ask the patient in regards to digital consultations before the patient has been in contact with the doctor to save time on the doctor's side. We have high customer satisfaction. We grow around 50% month over month, and we have a relatively high margin of how much money we can make with our doctors, which is around 30% on each visit. Over the next years, we will focus on the German market, grow to around 39 cities, which makes sense in Germany, treating around, that's at least the plan, around close to 4,000 patients, and with around of a million in revenue per month within the next years. This is Medlanes, basically the combination of technology and doctors to provide 24-hour on-demand healthcare. Thanks a lot.